What is Lyme disease? Well, many of us know about Lyme disease. It's a tick-borne disease from tick bites mostly, but also from other insects it can be transmitted. Lyme disease is a name on a complex, a very big complex on different symptoms. On one side, it can harm nearly each and every tissue in the body of humans and animals as well. So it harms each and every tissue, and it also comes through infections of different bacteria. It's not just one bacteria, and everybody talks about Borrelia, but it's not only Borrelia, it's Borrelia, it's Bartonella, it can be included the Ehrlichia, also Rickettsia. So very often I find patients very sick, they have been tested for Borrelia, no result, but they have untested bacterial infections from the other forgotten viruses or bacteria or strains. So we talk now on bacteria, so we have to look on Borrelia, Bartonella, Ehrlichia, Rickettsia, Babesia, so different bacteria. And even in Bartonella or even in Borrelia, we have different strains. So we have, depending on the region, we have different strains. So if we see in Europe, we have substrains of Borrelia, like Burgdorferi, Afzelii, like these. But if you go to Scandinavia, you have different ones, like Miyamoto, or if you go to Turkey, Torzike, or if you go to China, Sinensis, or if you go to Canada, or each area or country, they are developing different strains. So we have to test for those strains. So if we don't look on the right strain, we won't get a positive, clear result that then we can treat thoroughly. So I'm voting for differentiated lab technology to test thoroughly. And this is a critical thing in diagnosing the right infection to understand the disease, and then later we can, right on the point, treat the disease. How to treat the disease? Well, as I mentioned in other videos before, I'm happy to use the technology of SOT, which is a specialty that we have since 2 years, and we are happy to have it for our very sick patients. And it's an old researched technology since long years. The research has been done and now it's available. So we can treat each and every strain, like Borrelia miyamotoi, or Borrelia turcica, or Borrelia kurtenbachii. Not only Borrelia burgdorferi, the strain that everybody knows and everybody tests for, but the others shouldn't be forgotten. So I'm voting for really differentiated testing. And yes, if we know the right strain and we have then the possibility to sequence this strain like Kurtenbachii or Torzike, which is forgotten in 99 of 100 cases. So if we test for it and we know the sequence of this strain on the genetic basis, then we can have built or produced or prepared a really matching SOT preparation, individualized for this patient. So this is a really gain for patients and a really gain for us as doctors to have a really good, thorough and helpful treatment for our patients. So yes, Lyme disease is not just Borrelia. Lyme disease can be these all different strains, and I vote for differentiated diagnosis and treatment as well. Thank you.